Missouri lawmakers are being asked to protect telehealth services, including audio-only options in the upcoming legislative session. Our Missouri Chief Capitol Bureau reporter Emily Manley is live to explain what is at stake if changes aren't made. Emily?
Mandy, there weren't many positives that came out of the pandemic, but one of them was the advancement of telehealth services. But if you're one of the 400,000 Missouri households that don't have access to high-speed internet, you might be out of luck. But that's where audio-only health care can make a difference.
This is a bill that makes medicine easier for physicians.
It's a piece of legislation looking to protect a way of health care for Missourians.
What we've seen in some parts of the country is that they're starting to roll back some of these services. And so, they liberalize these rules to kind of cope with the pandemic.
Chuck Hollister with the Missouri Psychological Association says Missouri needs to join more than 20 other states in making sure insurance providers don't do away with reimbursements for telehealth services.
In some cases, we've seen them cut the reimbursement for audio-only telehealth. So we're going to reimburse it, but we're going to reimburse it at such a low rate that the provider can't cover their costs.
During the pandemic, millions used telehealth to continue with care when in-person visits weren't possible. Today, it's used to meet the demand of health care with a lack of providers.
We already knew that access was an issue before, but it's become even more pronounced. And so things like this will help to expand the access to services that are so much needed and can make a real difference.
Representative Melanie Stinnett is sponsoring one version of the bill, which would require equitable reimbursement for telehealth services while protecting audio-only options.
I don't think that the future of healthcare makes sense without having telehealth as a part of it.
Currently, about a third of telehealth appointments are done audio only. Both Medicare and Missouri's Medicaid program already made permanent provisions to cover telehealth appointments. Now the goal is to make other insurance companies follow suit.
The fact of it is we think about anywhere between 500,000 and 1 million Missourians really depend on it.
Now, another provision of this bill would prohibit insurance companies from mandating which platforms healthcare providers must use during telehealth services. This legislation is also bipartisan. It's also been filed by Democratic Senator Lauren Arthur from Kansas City. Mandy, we're all patiently waiting as session starts on Wednesday.
All right, I know there's going to be a lot to be accomplished during this session, but what will you be watching when it all gets underway?
Before I even start with my grocery list of priorities that I think that will be kind of debated throughout session, I want to say that it's an election year. So unlike previous years, we're going to have a lot more debate, maybe possibly even more infighting among Republicans and even some Democrats who are not only running for re-election, but we also have some Republicans and Democrats running for higher office. You have to remember next year is an election year for the governor, lieutenant governor, secretary of state. So it's going to be a very interesting year on that front first. But I think some other things that Missourians should know is, number one, there should be a conversation about childcare. Missouri is very much lacking when it comes to providers. And there's also many businesses across the state that are saying they're struggling to hire workers due to a lack of providers. Another thing that we can expect is education. It's something last year that lawmakers didn't do anything at all with. And there's many that are coming forward this year saying they want to talk about open enrollment and also expansion of charter schools. Let's also talk about a little bit of a crime as well, especially in the St. Louis area. Last year, we talked about Kim Gardner here in the building and also about St. Louis City Police Department and who should have control over it. There is a discussion among leadership in both the House and the Senate where it's possible the state takes over once again of the St. Louis City Police Department because they're concerned about the lack of officers and also crime in the St. Louis area.
Well, that is a topic that will get a lot of attention in St. Louis for sure. Emily, thank you.